Good evening, ladies and gentlemen. Dr. Ryan Livingston here, coming at you with Forged Medical, and of course, this thing isn't very big, huh? This webcam share. Let's see if we can change what it looks like. Oh yeah, we can. Rectangle. All right. Good evening. So I wanted to explain some of the things that I explained in clinic, but I wanted to back it up with some of the doctors that we work with and some of the doctors that we either work directly with or indirectly, and some of the doctors that are typically they have a lot of experience in the injuries that we talk about frequently, and you'll hear me talk about in the clinic frequently, such as the spinal ligament injuries and why they're prone to erratic behavior, and how to expect different things in the clinic, and why to expect different things in the clinic, and why to expect that an instability is going to be way different than somebody else in the office, even with the exact same subluxation patterns or those misalignments in the spine, and possibly even more degeneration than you have in your spine. And here's why. I'm going to let Dr. Hauser talk about it. And what he's going to talk about real quick is the most important aspect that I'd like to hit on, which is why certain parts of the body, what their function, their primary functions are. It will dispel some beliefs, and for those that don't actually know much about the spine or can't visualize it, this will be a very good quick explanation of some of the reasons why you feel some of the things you do. And when we go over the x-rays and the imaging and the reports and all those things that we use to gauge your care plan and your protocols, then it's going to make a lot more sense.
Well, you got to realize we don't have really big muscles in the neck, right? So in the neck, the primary stabilizer of the joint is going to be the ligaments, because the ligaments connect the bones together. In the lower back, or to support the lower back, because the lower back takes the whole weight of the body, where the neck takes the weight of the head. So the lower back, to support the weight, you have what? The abdominal muscles and the low back muscles. So a person could have significant lumbar instability. In other words, they have definite capsular ligament injury in this L4-5, L5-S1, L3, L4. But when you do flexion x-rays and extension x-rays, you don't necessarily see the subluxation. You don't actually see the subluxation. So
what he's talking about there are the misalignments in the spine and the vertebrae themselves, altering not only locally the vertebrae that have slipped, but they alter right there at the segment. And let's say it's right here in your mid back, okay, right here. Let's say those two vertebrae, all the vertebrae that stack on top of each other, let's say two down here are misaligned. Do you think that that's going to affect the structure above it? And how about below it too? Yeah, absolutely, it's going to. If you cause a structure to displace backwards, that's going to cause you to lean forward or bend a little bit more, or might even cause your back to posterior or backwards to collapse backwards a little bit to try and get itself to slide backwards. Okay, so that's what he's talking about right now. And he's talking about the difference between a stability in the neck and the low back, and why it's so much easier typically to see them in the neck than the low back, because the low back has so many other supporting structures. Doesn't mean the injury is less severe. In fact, it's often more severe because you got so much weight on top of your body crushing down on your butt and your hips and your pelvis. He's going to keep talking about that, so listen.
And you might say, well, how can I diagnose it then? Well, you'd actually have to numb the muscles of the back. So that's why there's a lot of false negatives. So if you've had a flexion MRI and extension MRI, it didn't show any instability, I'm telling you, if you have chronic stiffness of your lower back, it's probably because the muscles are tightening all the time, because they're trying to limit the excessive motion of the vertebrae so you don't injure a nerve. So there's a thing called the ligament muscular reflex when you have ligament injury, such as capsular ligament injury. So I guess I should look at one of the figures in the book. It shows all the various ligaments, all the various ligaments in the lower back, or some of the ligaments, and the fulcrum of motion in the lower back and the spine is the facet joints, and the facet joints have these capsular ligaments. So those are the ligaments that we primarily treat with prolotherapy and that's just an illustration of it. So those are the most important ligaments to treat with prolotherapy. The article, again, lumbar instability is an etiology of low back pain, so it goes through how, when you get ligament injury of the lower back, specifically the facet joints, what first occurs is arthritis in the facet joint. Because when you have ligament injury in the facet joint, though, those bones, they move excessively, and the pressures caused by the excessive motion will break down the cartilage, and bone spurs occur to disperse the pressure plus stabilize the joint. Because the body has three mechanisms to stabilize the joint. It has muscle tension, right? Muscle tension from ligament injury will stabilize the joint temporarily. The joint can swell. That's where some doctors inject steroids into there. I wouldn't recommend steroid shots into the facet joints, but some doctors do it because
pay attention here, because this is exactly what I explained to you guys out there, especially the patients that are currently in the clinic and those that want to come in the clinic. Pay attention to this, because you're going to hear me explain some things and why previous treatment, even though you might think it helped based on certain things, i.e. the pain went away, I'm going to tell you and I'm going to show you with repeated results, thousands and thousands of patients, and not every single patient has a total instability, but they have similar mechanisms when I'm treating them, which is why we 100% get imaging when necessary. We don't like to guess, we test, right? Just like you see these pictures here, I can see this exact stuff with an x-ray. No, you can't see soft tissue, but you can see the resultant issues when the soft tissue's damaged. So right here where he has the injection on the screen here, and he zoomed in on it, those capsular ligaments, when those get damaged, you're going to get excessive motion when you shouldn't have motion. And guess how you'll see that? You'll see that with an x-ray, with a specific type of diagnostic imaging, x-ray imaging that we typically do, which it's a dynamic image. It's a special set of imaging to diagnose the serious ligament injuries that I promise you, over 90% of doctors, I will even say like 95%, maybe even higher, they misdiagnose it. And I know this because I teach doctors across the U.S. And not only is it not in their notes, I've gone to ER facilities, and I'm going to continue to do it and teach them, like, hey, look, I've taught them how to take the x-rays properly. And then we've even gone so as far as to a couple times we had the x-ray techs themselves are suffering from these injuries and these issues that you're going to see, or that you can read about on our website, the symptoms, the chronic migraines for literally decades that have never been properly diagnosed, and energy and fatigue issues. It's not really their thyroid, but yeah, the thyroid could be affected. And we image these x-ray techs themselves, and I showed them exactly where their injuries were, and they're like, holy crap, we've never seen these type of tests before. Some they saw, but they never were taught what the point of taking the test or the image was. And we go over that in extensive detail. So I'll let him finish explaining this right here.
So you do get temporary pain relief, but because it blocks pain, I don't think it's a good idea, because you need to know the pain's there so you won't go play tennis. Because if you have instability and you're playing tennis because you got a steroid shot or you take anti-inflammatories, you're just going to make the condition worse. So we would recommend that you get the ligaments tightened with prolotherapy, and then you're addressing the root cause of the arthritis in the facet joint. If the facet joint motion continues, then eventually you're going to get disc degeneration, right? Why does disc degeneration occur? Because there's too much motion of the bones, and the discs are between the bones. And always think of this, the discs are in the front. So if a person had pain from a disc, you've got to explain, why do you have pain in the back? The ligaments are in the back. So the cervical spine and the lumbar spine are basically the same in the sense that they both have a lordotic curve. They have the same lordotic curve, same exact lordotic curve. So then what is causing the ligament injury in the lower back and the neck if somebody didn't have a car accident or fall off a bike or something? Well, it's the same process. I just call it slouching, right? Because slouching, like slouching in the neck is you're looking down, looking down, looking down. So I'm going to turn this, I'm going to turn this. So if I'm using my computer and I go like this, I have a nice...
This is why in the clinic we teach you the ABCs to get results the fastest possible. The B is breaking bad habits. So we're going to teach you proper work ergonomics so that outside of the clinic, you're not stuck slouching 24/7, really, 8 hours a day, stuck in a slumped position, because you'll still get results, but you're going to decelerate the pace at which you get results, which will demotivate you. And it's nothing that we're doing that's getting you poor results. It's what you're doing. And I have to help teach you guys that because it's a team effort, And so that's exactly what he's explaining here is you don't want to undo the results that you are improving in the clinic.
Lordotic curve, like in other words, I'm lifted my chest, then I have a lordotic curve. If I go back in the seat right now, I'm slouching, now I'm using the computer, I'm causing ligament injury in my neck, now I'm causing ligament injury in my back. So the number one cause, really is slouching. So in the paper, in the results section of the paper, prolotherapy and PRP for facet joint pain, disc degeneration as a consequence of lumbar instability, and again, looking at the various results with prolotherapy or PRP for disc degenerative pain. There's also a section on sacroiliac mediated pain, and you'll see the results at 1 year. So in other words, the people got so many prolotherapies or PRP procedures, the results were anywhere from 70% pain relief to 90+% pain relief.
Now he goes on to talk about how many injections that is. Now, just so you're aware, that's about, he says somewhere around 20 injections. So that's, that's a pretty penny, okay? You just got to be aware of that, And then he goes on, and I don't believe it's this video, but he does a lot of discussion about structural spinal correction. He has a doctor in his office, a primary care spine physician that is a chiropractor as well, who does some type, and I don't know exactly what the type is, of spinal correction. And that goes hand in hand with the prolotherapy that you're seeing here. I wish I could point to the screen. I guess I could use my mouse if you can see it. But once you get those lordotic curves back into the spine that he was talking about, you put the weight back on these facet joints, and when you structurally correct them, you reopen up those holes that the nerves come out of, and you also take the pressure off the spinal cord, which allows these things to heal faster. You take pressure off the cardiovascular system or the blood vessels and vasculature so that they can pump and get imbibition. You put the proper structure back into the spine, and when it moves properly, it flushes properly. Okay, the only way to get nutrients into the spine is to move it, and it means move it properly. You can't get good proper motion back into the spine if none of these, let's say all of these 4 joints that you see right here are damaged and injured and subluxated, but everything above it is moving properly. No, you've got to get these ones moving properly, which is why the chiropractic adjustment, the chiropractors are the most trained. They're the professionals. You don't want a high school basketball. If you want the professional basketball or NBA trained basketball player on your basketball team, if you're on the line for, well, let's even say your life, but you're on the line for the most money you've ever made in your life, or do you want somebody that's from high school playing basketball on your team? Chiropractors are the professional elite athletes when it comes to adjusting your spine. Sometimes you'll see in the literature called manipulation. But I just wanted to show this quick video. Hopefully you got a clearer understanding of some spinal instabilities and a little bit of good discussion about why we go over some of the things we do in the clinic. All right. Peace and love. Any questions or comments, please leave them in the videos. We'll get back to you as soon as we can. If you want to call or book an appointment into the clinic, we look forward to that too. Forge Medical, we're in Pittsburgh, Pennsylvania, looking to expand some clinics soon. So also, if you're somebody out of state, sync up with us. We do have an accelerated spinal correction program. It takes about 2 to 3 weeks. Rent a Airbnb. You'll be in the clinic multiple times a day. We can get you structural correction, the same amount of structural correction. You're just in the clinic a lot more frequently. So that is a possibility. And Dr. Hauser, they do something very similar. in their clinic. All right. Ciao.